What is a febrile seizure? Your baby has had a very high temperature for the past 2 days, and tonight, just as you're putting her to bed, out of nowhere she starts shaking vigorously, her eyes start rolling upwards, she is not responsive, and she completely soaks her nappy. Yes, what she is experiencing is something that no parent ever wants to bear witness to: a febrile seizure. Hello, and welcome to MedTouch, the best place to find the right medical information. The dread, distress, and utter heartbreak of your child's first febrile seizure is one of the worst things you can ever experience as a parent. It's overwhelming, unexpected, and you don't know why it's happening or when it's going to end. Thankfully, these alarming seizures are usually harmless, and almost all children make a full recovery afterwards. But what exactly is a febrile seizure? A febrile seizure is a relatively common medical condition in children. In fact, it's estimated that 1 in 30 children experience at least one during their childhood. They typically occur in otherwise healthy kids aged 18 months to 6 years old. However, children appear to be at the greatest risk for febrile seizures around the age of 2. Seizures are the result of a sudden abnormal electrical impulses in the brain, which can be caused by any number of factors that interrupt the normal electrical connection between brain cells. Febrile seizures are specifically triggered when a child's body temperature rises above normal, usually in response to an infection or illness. Febrile seizures can either be localized to one specific part of the body or generalized to all body muscles. Most febrile seizures only last less than a few minutes and typically occur within the first hours of the onset of a fever. During a febrile seizure, your child may experience a loss of consciousness, uncontrollable shaking, eye rolling, rigid limbs, and a loss of bladder and bowel control. Once the seizure stops, your child will regain consciousness, but they may remain sleepy or irritable afterwards. Contact emergency services immediately if this is your child's first seizure, the seizure lasts more than 5 minutes, your child does not regain consciousness after the seizure stops, a second seizure occurs after recovering from the first episode, the seizure is localized to one part of your child's body, and if your child still looks unwell or still has a very high fever after the seizure has ended. If your child has a febrile convulsion, you may be concerned that they have epilepsy. Epilepsy is a condition that causes repeated seizures without a fever or any known cause. Children who experience febrile seizures have a very slight increased chance of developing epilepsy in the future. This very slight chance increases if the child has prolonged or reoccurring seizures or experiences seizures that occur in only one part of the body. Although febrile seizures can be extremely scary and upsetting to witness, just remember, they're fairly common and almost always harmless. Always follow your doctor's advice and be sure to continue to control your child's high temperature in case of any viral or bacterial infection through medical or non-medical methods. Thank you for watching. Be sure to like this video, subscribe, leave us a comment, and turn on that notification bell so we can stay in touch.